I don't know what it is about these gloves, but putting on sterile gloves makes people panic. So today we're going to talk about how to put them on and take them off so that you don't break sterility right after this. Welcome back. My name is Tammy and this is NurseMinder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. So today we're talking about sterile gloves, how to put them on and how to take them off. Now it's important to know why you're using sterile gloves because there are non-sterile gloves out there as well. In sterile gloves, you might be doing a dressing change in which you want to protect the patient from microorganisms, from the surface around them, and from yourself. You may be working with patients' bodily fluids and you don't want to get contaminated. Or maybe you're giving medications that are cancer causing and you need that extra layer of protection. Whether you are working in home care, whether you are caring for somebody who lives at home, or you're working in the hospital, sterile gloves protect both you and the patient. So let's talk about what we need to do to get prepared. One of the first things we need to know is how to identify sterile versus non-sterile. If you see gloves in a box like this, non-sterile. We will use these to help clean our station, but they're not going to be the ones we use for our procedure. All right, so what we're looking for in a sterile package is in fact that it is in a sterile wrapped container, sleeve. And we know that it's sterile because the package here tells us that it is. So I'm going to bring this up close and we can see that it says it is sterile. The other thing we're going to look at our package is to make sure we have the right size. So these ones are a medium. We need to look at the expiry date. And then we need to inspect the package itself to make sure there's no rips or tears in those seams. So for example, if this was the package I picked up, it's already open. I can see there's contamination. These would go in the garbage. So I've gathered the right package, and now I know I'm going to get my table ready because I need to make sure I have a sterile surface to work with my sterile gloves. So let's head to the table. Okay, so here we are at the workstation. And one of the first things I want to do is make sure my work area is clean. So I'm going to put on a clean glove, grab a disinfecting towelette, and wipe down my surface area. In this video, I'm going to be demonstrating the donning and doffing of gloves from two angles. First from the side as we are currently, and then I will move the camera so that you can see it from your positioning as you are actually putting on the gloves. So now that my area is clean and I've got that in the garbage, I'm going to now take my sterile gloves and I'm going to open up my package. So as I'm opening up my first sterile package, the first layer will reveal the second package of sterile gloves. You want to be able to put this down so that you can read the writing, and I will just flip this around here so I can do that. Some will have a right and a left picture on there. And either way, we're going to open it up and we are going to then unfold the top and bottom flaps. And then you'll notice there's also a flap down the middle. We're going to put our fingers under there and pull open the paper. Now we visualize we have a right and a left glove. They are folded so that the cuff is up towards the thumb on each glove. I'm going to start with my non-dominant hand and grabbing the cuff of the dominant glove. I make an opening so that I can slide my right hand into the glove. I want to be careful that I'm only touching that area of the glove and I let it go once my glove is seated. My right hand is now sterile and I need to stay on the inside of the cuff on the left-handed glove. So I'm going to put my fingers between the cuff and the glove, make an opening, and slide my left hand into the glove. With this, as the glove is proceeding above my wrist, I can now extend that glove, keeping my fingertips only on that portion, and release. You can see I probably should have taken my watch off ahead of time. I can now take my gloved hand under the cuff of the first glove and extend that one and release as well. Seat those fingers in tight and you are ready to go. In removing the glove, I'm going to take the inside cuff of one glove, pull it up and down over my fingers, keeping all of the contamination controlled. Then I'm going to slip my clean hand under the cuff of my remaining glove and do the same such that the gloves will fold onto each other and controlling the contamination. Now let's take a look at this from another angle. Step one, let's open my package. Inside this one will be a second sterile package that contains my gloves. I see that they are medium. I can read the packaging, so I'm now going to go ahead and open this second sterile package. Unfold the top and the bottom flaps, and then along the middle you can see the other flap that you'll put your fingers underneath and pull open. You can now see the gloves have a cuff that goes up towards the thumbs on both the right and left glove. Using my left hand, I'm going to create an opening at the base of the right glove so I can slide my right hand in, dropping the cuff. My now right hand is sterile. I'm going to go underneath the cuff of the left-handed glove, create a pocket so that my left hand can slip into the glove. And as you're sliding your glove on, you may notice that your fingers don't always go into the right spot. That is okay, just take a moment. Extend the cuff and drop it. Now you can take your sterile left hand under the cuff of the right hand, extend it and drop. Seat the fingers, make sure the gloves are nice and snug, and you're ready to go. Now at the end of your procedure, you want to remove those gloves. Grasp the inside cuff of one hand, pull it down towards your fingers, containing all the contamination inside. Slip your clean hand under the cuff of the remaining glove and do the same. Removing both gloves together, and now all you need to do is wash your hands and you're done. So there you have it. It's actually a pretty straightforward process. So let's do a quick summary. Number 1, are you needing sterile gloves or clean gloves? You need to make that distinction. Number 2, gather your supplies and clean your station. Number 3, open up your gloves maintaining sterility and put one glove on at a time using those techniques I've shown you. Number 4, when you take them off, you want to make sure you still maintain sterility. There's nothing worse than putting body fluids on your hand and then you have to go and clean it up. Ugh. So follow those principles and you won't go wrong. Now it does take practice, so don't be afraid to reset your package and do it over and over again until you are perfect.